Hi, everybody. I am Dr. Zainab Vora, and I'm very happy to have Major Dr. Purnima with us, who's cleared her DNB radio diagnosis theory exam with an amazing score of 275. Congratulations, ma'am. It's so inspirational to see you in uniform on duty, and then taking out time to talk to me. So, first of all, congratulations, and please tell us, about your journey and how are you doing?
Ma'am, thank you so much, first of all. Because of e-conceptual radiology and lectures by you and Nikita ma'am and all, I could score this and I could clear theory and score such a good score,
Thank
all because of e-conceptual radiology. And basically, I completed my MBBS in 2014, ma'am. Then I joined Army. And we have a clause of 4 to 6 years. We have to work as a medical officer. Then we are eligible for PG. So
you.
then I secured a decent track. Then also I used to follow Maro and Apta lectures and Nikita ma'am lectures also. And I am actually posted at Base Hospital Delhi, ma'am, which is a very busy hospital because it is for Army, Air Force, and Navy. It is one of the base.
Yeah.
Like anyone from any part of the country can come directly.
Hmm.
Army untreated family members.
Right.
So it is one of the busiest centers. So we used to have daily 30 to 35 MRI, 35 to 40 CT in the initial first, and we are only two residents per year, ma'am. That is the main drawback. Like
Yeah. Yeah.
workload is everything is fine, but the residents number of residents per
Mhm.
year is only two residents. So we used to find a bit difficult in the initial days.
Yes.
And actually, I came to know about e-conceptual radiology in my second year through my junior, my no, junior batch. So then I subscribed for e-conceptual radiology and I started seeing in all the classes and everything, ma'am, at the end of second year and third year only, basically.
Right.
But my strategy for theory exams,
Hmm.
what I because we used to be very busy and they left us exactly 2 months before the exam, and
Hmm.
before that we used to do alternate every third day night duties, and we used to have this hectic schedule.
Hmm.
So then I used to listen all the classes in 2x, try to listen in 2x,
Yeah.
and then I used to go through the PDF.
Hmm.
The PDF helped me a lot. I used to revise many times in the PDF and everything.
Yeah.
Then I had the notes also,
Hmm.
e-conceptual notes, every notes and everything. Previous year questions, and I used to go systematically with the questions, ma'am.
Right.
I planned like for 3 to 4 days. I used to do question paper one. I used to do subjects like
Hmm.
brain for some topics, and I used to try to listen every class most except MSK because an MSK used to be lengthy. But
Yes.
otherwise, every I used to cover every section of the e-conceptual radiology app, and I used to revise in the PDF, ma'am. And what I felt is like initially when we used to present cases, we used to do from RSNA articles, ma'am. So it used to take me a lot of time to get the source from where to
Yeah.
get the information, valid information. So then after a conceptual radiology, I used to study. Then I can understand that all the article, whatever important
Yeah.
points here, that I used to get from a conceptual radiology videos and PDF.
Amazing. Great. Very
So
happy,
it helped me a
basically.
lot. It helped
Yeah.
me a lot.
Great. Great. Tell me,
Thank you
how
so
was
much.
the exam like? No, thank you. How was the exam like for you? How did you approach, writing the answers? Any advices for the juniors there?
Ma'am, actually, we had a fact in June 2024. At the time, I didn't prepare well. So, but some stat questions which we used to see on
Hmm.
the CT and MRI consoles, we used to like pituitary adenoma, pulmonary edema. These are the common questions, common topics also which we used to do in clinic practice daily.
Yeah.
So then at that time I cleared that FAT exam. So
Hmm.
that gave me a boost like what strategy I have to do in writing theory exams and everything. I used to have that PDF as my base, and then I used to include one image in every session of every sheet of my answer in the 5 sheets, I used to try to follow that flow chart. Wale, you used to say that you should be presenting the answer in a very beautiful way. That flow charts and diagrams used to be
Yeah.
helpful, and examiner also want to see in a very strategic way. I
Yeah.
used to follow all the strategies only. Any actually I couldn't complete all the videos, but
Hmm.
how much like whatever the theory results showed the results, that is all because of e-conceptual radiology. It helped me in the very short span of time what we could get to study and everything.
Amazing. I mean, the app is also not meant to be completed, like PG. This is something where the learning will always continue, Anytime you want to refer to something, you can go back and, see this. So that's how the idea is. So, the idea is not to have a crash course or, finish everything. It's ever evolving, ever growing. And, someday we'll have, people like you who will now come over to the other side as teachers and guide your juniors. So that's what the idea is, to have the learning continue always. So I am so proud of you, ma'am, and to see your journey, and your.
Thank you, ma'am.
I always get so inspired, seeing anybody in uniform and serving our country. So thank you so much for that. And I am so glad.
Thank you so much,
Yeah, we
ma'am.
could play a very small part in your success. I'm very happy that we were a part of that, and more power to you. The practicals are coming up. I'm pretty sure you're gonna ace it as well. So all the very best from our side, and let me
I
just
will meet you in Chris, ma'am. I would like to meet you in the coming Chris
absolutely.
exam about
Yeah,
it.
we are very close. I live in Delhi, so anytime you get off, I would love to meet you.
Ma'am. Sure. Thank you so much, ma'am, for inspiring from the days of my NEET PG
Thank you.
till completion of my DNB and further on.
Thank you.
Thank you, ma'am.
So much.
Thank you.
Means a lot. Bye bye.